Men over 50. Here's a twist most men don't expect. Deliberately pausing during masturbation can lead to stronger, longer control and a calmer blood pressure response, so you feel safer and more confident, not nervous and rushed. I'm Dr. Masha Aniel, a urologist with over 30 years of caring for men, guiding thousands of patients through erection issues, blood pressure concerns, and intimacy questions. This is educational, not medical advice. Talk to your doctor for personal guidance, especially if you use heart or blood pressure medicine. Before we dive in, hit subscribe. Tap the bell so you don't miss practical tips you can use today. And type 1 if this helps or 0 if it doesn't. I read your feedback and build the next videos around it. Hold that first thought, because in a moment I'll show you one small grip change that many men say immediately slows the rush to ejaculation and even tames a blood pressure spike. It's simple and safe, and you can try it the next time you practice. Why does this matter so much after 50? Because arousal and climax trigger the body's stress response. For a moment, heart rate climbs, pressure rises, and if you're already on the edge from hypertension or anxiety, that spike can feel scary. At the same time, a lot of men notice faster ejaculation with age or medications, and that can chip away at dignity. Start-stop is a gentle way to build control. It's not about being a machine. It's about presence.com and the freedom to enjoy closeness without fear. Here's the simple science. Erections depend on nitric oxide, the messenger that relaxes blood vessels so the penis fills like a sponge. The nervous system has two gears: go fast and go calm. When you rush and hold your breath, you hit the fast gear, pressure rises, and ejaculation triggers sooner. When you pause and breathe out slowly, you invite the calm gear, vessels relax, and control improves. Think of arousal like riding a wave. If you stand tall and breathe, you glide. If you stiffen and push, you wipe out. Now that you see why this matters at your age, let's set up the practice so your body feels safe. Choose a comfortable position that doesn't compress your belly or neck. Many men do well semi-reclined with a pillow under the knees. Keep a good lubricant nearby, water-based or silicone, because less friction means less clenching and fewer microspikes in blood pressure. If you share this skill with a partner, agree on signals and short pauses first. Consent and comfort are not just polite. They lower stress and help your erection. Begin gently. Warm your hands and place them on your thighs, belly, or chest for a few breaths. Inhale softly through your nose, then exhale longer through your mouth like you're fog in a mirror. The longer exhale is acute to your blood vessels and pelvic floor to loosen. Touch the penis with a light grip and slow rhythm. As arousal rises, aim for the place just before ejaculation to the edge point. Most men describe as a warm surge in the base of the penis, a tightening in the perineum, or a feeling that the point of no return is approaching. Here's where it gets surprising. The first pause often feels too early. That's the point. As soon as you sense that surge, stop the strokes. Place your hands still on the shaft or switch to a gentle touch on the inner thighs, scrotum, or lower belly. Keep your jaw loose. Breathe a smooth inhale and a longer exhale. Let the pelvic floor soften, what we call a reverse kedgel, which feels like releasing the muscles you would use to stop a stream of urine. Notice the urge crest and then settle. This is you teaching your body to ride the wave. Hold that thought, because in a moment I'll show you how to restart without losing your erection, even if it softens a bit during the pause. That one adjustment helps men stick with the method without frustration. When you resume, change one thing. Lighten your grip, or switch to a slower rhythm, or adjust the angle so you're not drilling the same nerve endings. The frenulum, the underside just below the glands, is a hot spot. Spending less time there and more along the shaft often buys you more runway. Repeat this build and settle rhythm several times. Don't count or chase a number. Use a song or your breath as a guide. Let's close that first loop. The small grip change that slows the rush. Open your hand a little wider than you think you should, and cut the squeeze by about half. Avoid forming a tight ring near the base, which can act like a tourniquet and raise pressure in the wrong way. Instead, glide the whole hand with lube and let the thumb avoid the sensitive underside when you're close. That subtle shift lowers peak stimulation and gives your brain a second to stay calm. Gerard, 63, came to me ashamed that he climaxed quickly and then felt his head pound. His blood pressure was borderline, and he was gripping hard without realizing it. We coached him to use more lubricant, lighten the grip, and exhale longer during the pauses. After 2 weeks of practice most evenings, he said, "Doc, I last longer, the pounding is gone, and I actually enjoy the ride." That's not magic. It's mechanics and patience. Before we go there, notice how your body telegraphs the point of no return. The scrotum tightens up, the perineum clenches, the breath stops. In that moment, your job is not to push through. Your job is to put on the brakes, gently stop touching for a handful of breaths, soften the belly, and let the wave pass. Some men like a gentle pinch just below the glands for a couple of seconds, then release. That classic squeeze quiets the reflex for some, but keep it gentle and brief so you don't irritate the tissue. Here's a mid-script question I hear all the time. What if you keep losing your erection during the pause and can't get back? Hold that thought, because in a minute I'll give you a simple restart sequence that does not require porn, pressure, or forcing. Safety matters, especially when blood pressure is part of the picture. Avoid breath holding and pushing, what lifters call the valsalva, that spikes pressure and can trigger headaches. Keep your jaw unclenched and your exhale longer than your inhale. If you take nitrates for chest pain, do not combine them with If you're on alpha blockers for the prostate, stand up slowly afterward and drink a small glass of water to avoid light. If you feel chest pain, severe headache, or vision changes, stop and get care. Omar, 59, had well-controlled hypertension and said masturbation felt like a sprint followed by guilt. He relied on intense pornography for stimulation and felt desensitized. We cut the visual intensity for a week, had him focus on touch, breath, and sound, and integrated. He told me, I didn't think I could get aroused without the screen, but the pauses made everything more sensitive. I feel calmer and erections last longer. Now, the restart sequence to close that second loop. If the penis softens during a pause, don't fight it. Keep 3 slow breaths. On the next inhale, slide your hand from the thighs to the base of the shaft and make a gentle circle, not a squeeze. On the exhale, add a slow pelvic rock tip, the hips forward a little while. You imagine warmth traveling up the shaft. If you need a bit more, lightly stroke the inner thighs or the perineum, the area between the scrotum and anus, for a few seconds. Then return to the shaft with a slow glide. Most men regain fullness without flipping the body into stress mode. You can bring this into partner play to, if you're close to ejaculation during intercourse or oral sex, pause and switch your attention to your partner's pleasure hands on the clitoris and vulva with consent, or a few moments of kissing and touch. Couples tell me the pause feels intimate, not awkward. When you name it, give me a few breaths. I want to make this last. Presence builds trust, and trust helps. Here's where it gets surprising. Strength in the pelvic floor isn't always the answer. Many men already grip their out of habit. The stop phase is about relaxing those muscles, not clenching them harder. Save strong kedgels for separate training. During arousal, think reverse kedgel softening on the inhale so blood can enter the erectile chambers like a gate opening on a canal. A few add-ons compound the benefits. A short walk most days keeps the inner lining of vessels healthy. Gentle hip mobility like knee hugs or ankle pumps turns the legs into natural pumps that help circulation. When you plan to practice, sip a small glass of water about half an hour beforehand so you're comfortable but not rushing to the toilet. Keep the room warm and private. Tension falls when you feel safe. After ejaculation, urinate if you can, clean with warm water, and sit for a minute to let your nervous system settle. Paul, 71, was on a beta blocker and worried he couldn't get to climax if he slowed down. We practiced short pauses, just a handful of breaths at first, and had him change grip and rhythm on each He reported back, I used to feel trapped between too fast or losing it. Now I can land the plane where I want. As his confidence grew, so did the closeness with his partner. Troubleshooting helps you stick with it. If you feel numb or bored, you may be using too much pressure or too fast a tempo. Slow down and add more lubricant. If you feel too revved, lengthen the pauses and make the exhale even slower. If a particular fantasy rockets you to the edge, set it aside for a few sessions and focus on sensation, temperature, movement, texture. If the penis is circumcised and dryness is an issue, a thicker silicone lubricant can make the glide smoother and reduce friction. Now that you'll see why this matters at your age, let's tie the thread. Start-stop is not punishment or delay for delay's sake. It is you learning the language of your body, the early signals, the breath that soothes, the grip that guides so you can choose your timing with dignity. Whether you're alone or with a partner, you can pause, redirect to their pleasure, and re-enter with steady confidence. That skill often spills into life off the bed, calmer reactions, better sleep, and a bit more patience with yourself. Let me recap so it's easy to remember. Set a comfortable scene with warmth, privacy, and lubricant. Build arousal slowly while breathing through your nose and letting your exhale run longer. As you near the edge, stop the strokes, relax the pelvic floor, and let the waves settle. Restart with a lighter grip, a slower rhythm, or a new angle. Repeat as you like and close with care in it. Clean up, sip water, and rest. Practice a few times a week, and some men notice steadier erections, better control of ejaculation, and a calmer blood pressure response within a couple of weeks. Gentlemen, you deserve ease, connection, and choice at any age. You're not broken. Your body may just need a new rhythm and a kinder coach. If this was helpful, subscribe, tap the bell, and type 1 if it helped or 0 if it didn't. Keep breathing. Keep listening to your body and let the wave carry you instead of knocking you down.